Okay, there are some questions that pertain to this concept, like should I respect what the family wishes or what the patient wishes in case of a dying patient? Should I withhold the truth from the patient if it's going to hurt his feelings or make him feel depressed? Is there a time where my care is doing more harm than benefit, and then should I be discussing the end of life or palliative care? So is there sometimes in the day where I can harm someone? Is there sometime in the day when I did an unethical action? And so we look at these questions and we ask how uh, moral or how ethical some of our professional behaviors are. And to be really professional, we need to get those skills and abilities of ethical practice. So that includes being morally sensitive, um, being able to reflect on those ethical decisions, analyze them, and be able to make a decision that is ethical. And so we talked about morality within the scope of ethics. Let's define ethics. So your book defines ethics and morality, and it is helpful to think of all those approaches to ethics as foundations for morality and moral behavior. And so when we think of ethics, we think of it as the study of or examination of morality. And when we think of morality, it's a broad term. There is not a commonly recognized definition, but we refer to it as the expected set of social standards or morals that guide the behavior. And when we are in a ethical situation, we're going to be using ethical sensitivity that helps us think and reflect and analyze and think critically to see what is our ethical obligation, what are our ethical priorities, so that being ethically sensitive is going to help us in making an ethical decision making. So, like we stated, there are some terms that we need to get familiar with: ethical sensitivity, ethical reflection and analysis, ethical decision making, moral courage. And moral courage enables us to act on our decisions even under the most challenging circumstances. And so, also, there have been many approaches to ethics. And mostly those approaches are philosophical, and they ask fundamental questions about the nature, the source, the meaning of those concepts. Is it good? Is it bad? Is it right? Is it wrong? Um, but here, when we go above and we go, for example, to the meta ethics, we go beyond what's good and bad, what's right and wrong. We then rather we provide the foundation how to think about right and how to think about wrong and how to think about good and how to think about bad. And then when we go discuss these issues, we can get to common terminologies that we can use in various situations, as opposed to the norms and normative ethics that deals with everyday's right and wrong actions. And when we are faced with a moral choice, that applied ethics refers to the process of applying those ethical theories, reasoning in also daily activities. So the scope of ethics is very broad, as you can see, and it has many different dimensions, from societal ethics to organizational ethics to bioethics to clinical ethics, professional ethics, personal ethics. So what social ethics mean is that those societal ethics that serve the larger community. And when we look at the societal ethics, we saw that we have that social law that the minimum standard of behavior that all members of the society has to adhere to. And then we see that we have also legal standard, clinical standards of care, liability, negligence, malpractice, and these are the clinical ethical obligation we owe to our patients. And our professional life is guided by the regulatory parameters from the Practice Act that defines education requirements, or the scope of practice of the nurse, or the accreditation standards that determine how a healthcare facility must operate. So when we're talking about organizational ethics, we're talking about a set of formal and informal principles that are gonna guide the behavior, the decisions, the actions taken by members of that organization. So what are some examples of that? If we look at this, we see how the organization allocates their resources, how they solve conflict of interest, how they disclose medical errors, how do they approach fraud, abuse, impaired providers, is there inadequate staffing levels, patient safety, policies in regards to compensations, and use of restraints, how are their hiring patterns in regards to minority patients and minority staff. First and foremost, when we talk about professional ethics, we have to acknowledge that the relationship between the patient and the nurse is first and foremost an ethical one. And those ethical standards and expectations come from those code of ethics and code of conduct. So we know that the American Nurses Association has that code of ethics for nurses that establishes the priorities in the ethical practice of nursing, such as compassion, respect, commitment to the patient, advocacy for the patient rights. So if you look at those provisions, and we need to be familiar with all the provisions of the American Nurses Association. But the first provision of the American Nurses Association was that the nurse practices with compassion and respect for the inherent dignity, worth, and unique attributes of every person. And this gets us to reflect on those ethical principles. And there's at least 6 ethical principles that you have to get familiar with: beneficence, non-maleficence, justice, fidelity, veracity, and autonomy. So if we start with the autonomy, and let's say the person has cancer and they decided they don't want to get chemotherapy. So their autonomy, or the right to refuse or a right to accept, irrespective of consequences, is what autonomy means. So it is your job as a nurse to support that decision and respect that decision. So if you get a question about this, you answer accordingly. So then the beneficence is basically doing good, doing what's right. And fidelity is, so if you said, I'm gonna go and get you the answer for the question, you need to go get that answer and come and follow up with that. And justice entails allocating fairness in an example for that would be like if you have 4 or 5 patients and you have like a patient that has been difficult to deal with versus that patient, a nice patient. So how do you allocate your time providing care for each and every one of those? It has to be equal. Equal in how much attention they need, and that's justice. Sorry. An example of non-maleficence or doing no harm would be that triple check and 10 rights of medication and all those safety checks in place, the fall risk guidelines and practices, and those prevention of bed sores and so on. Unless it's veracity, and that is telling the truth. Be frank with your patient. Don't lie. If they ask you something, answer it. So, bioethics and its subcategories of clinical ethics are closely related to professional ethics. And so, what are some examples of bioethics? You have those discussions around abortion, uh, child abuse, uh, contraception, genetic enhancement, genetic mutation, and like all those genetic studies, prenatal genetic studies. What do you do if with the outcome of that genetic testing? What do you do with impaired newborns, severely impaired newborns? This is where you're going to talk about consent, minor consent, or their ability to refuse treatment. This is where you talk about confidentiality, cultural conflict, the domestic and elder abuse, intimate partner abuse, informed consent in general, pain management, especially when in the context of opioid use disorder, the patients as research participants, as research subjects, as and also protecting patient rights and their preventing bias. And also you're going to have the advanced directives in here, the organ donation, organ procurement, organ allocation, terminal care, palliative care versus do not resuscitate versus allow natural death. Do we withhold or withdraw life support? And also along that line, the allocation of research funding for furthering the profession, all those health insurance claims, health care for everyone. So when talking about informed consent, we need to talk about uh, and understand what's our role in the informed consent. So it is not your responsibility to explain the procedure, all what it entails, whether the purpose, the complete description of the procedure, and that's the provider explaining to the patient in their primary language, even if that means that they need to get a translator. And what you do is only be a witness for that. So you need to ensure that they explain the benefits and risks of that procedure. Is there an alternative to that procedure? If they didn't have it, what else can they do? So you only make sure that the provider gave instructions about that procedure, and whether your patient was coherent, competent, and understood what the explanation entailed. And so it includes all adults that are competent, your emancipated minor, and so that makes sure that this patient understood everything. And then you make sure also that the patient signed that consent and you be a witness for that consent. What if the patient asks you further questions about the procedure? They tell you, I don't understand the procedure, or like they forgot what the doctor talked about, the risks and benefits. So what do? You call the provider and you ask them to come and explain those procedure um, uh, details. It is not your role to explain the risks, the benefits. It is the provider's role. What you do is make sure that they understand the procedure, they are competent, and that they sign the document. So also within this, we spoke about advanced directives. Advanced directives are living will. These are your patient's wishes that are expressed that if they become incapacitated, okay, what do I want? I don't want you to put me on a ventilator. I don't want you to put a tube feeding. Versus the DPOA, which is a durable power of attorney, where the patient assigns a healthcare proxy that will make decisions on their behalf, have should they be incompetent. Also, the third option is where the provider rights that do not resuscitate. In some states, they call it allow natural death. If that's your patient wishes, you need to make them known and you need to ensure that they are documented in the chart. So then we talked about abuse, and so as a nurse, you have an obligation to report. So you have that mandatory obligation to report any suspicion of abuse, be it a child, an elderly, or domestic violence. And so when you are caring for that patient, you do your assessment and then you ask them some history questions. If you suspect abuse, you're gonna need to report that. You're not gonna wait. You're not gonna wait, even not wait to gather more data or play the detective with this. Just go and report it to the appropriate authorities and they will take it from there. Another obligation is to report infectious diseases to healthcare authorities. This is mandated in each state. On a final note in this subject, you need to understand that as you evolve and grow and mature, your personal ethical ideations, um, uh, reflection, and your ethical uh, sensitivity is going to grow with you and it's going to evolve. So, what is the difference between an ethical problem and an ethical dilemma? What are some examples of that? In ethical problems, any problem with an ethical dimension. For example, let's suppose you're working the night shift and your coworker comes and tells you, "Oh, I need to leave half an hour early because I need to drop my kid to school. And can you punch out for me?" That's an ethical problem. An ethical dilemma is where you see that you have a problem that requires that something must be done wrong to achieve a rightful thing. So in this situation, you have that dying patient that he's crying and begging you to stay with them. You have other patients to care for, and the unit is short staffing. And so you remember when we talked about the principle of justice. So now we're going to break that principle of justice to achieve the last wish of a dying patient. So we already covered some of those ethical principles in your book in page 392. You have all those ethical principles: respect for persons, non-malfeasance, beneficence, justice, fidelity. And so you have to understand those principles. These are going to be like your camera lenses that gives you, that filters situations and how do you view the situations differently, like the example we gave a minute ago. So please make yourself familiar with these principles along with the ones I covered in the previous slide. Ethical theories. And here, every ethical theory would kind of give us a different view of the same situation. And so, like, the ethics of duty is based on the ethical approach of deontology, in which moral duties are seen as self-evident, needing no further justification. And thus, the action here is based on you need to act according to a specific duty simply because it's the right thing to do. Whereas the ethics of consequence is based on the teleological view that moral actions are defined entirely on the basis of the outcomes or the consequences of that action. The ethical theory of ethics of character, and this theory emphasizes character, um, where we're looking at virtue ethics, and it differs from the previous ones because it and this one relies on the character of the individual themselves. The individual is the primary source of moral action. And then ethics of relationship emphasize relationships and the nature and obligations for us as human in living in a community where we have those human relationships. So what does the nurse do when she has or he has to make certain decisions that are critical to an ethical practice? And sometimes it sounds complex, but really in applied ethics, it's you apply specific you need to do a specific decision. So you base it on ethical concepts that you see relevant to making that decision. So, when we talk about ethical decision making in practice, we are going to have some times when we must take difficult ethical decision, and there might be some conflict within the team or between the team or the patient or the patient's family that cannot be resolved. So who do you call? You call the organizational ethics committee, and that's how you resort to these to solving some of these problems. Ethical issues in nursing, there are a few. So there was a study that was done by Fry and Riley, and they examined the ethical issues that registered nurses face in their practice. How often do they um, face those? Are how does those impact them, and how do they handle them? And so they found that these are the most frequent ethical issues experienced by registered nurses. Number one, protecting patients' rights and human dignity. Number two, respecting versus not respecting informed consent to treatment. Three, providing care with possible risk to the nurse's health. Four, not using physical or chemical restraints. Five, working with staffing patterns that limit patient access to nursing care. And they were most disturbed by the problems. Number one, coping with staffing patterns that limit that patient access to nursing care. So that's the order of priority. Prolonging the living dying process within appropriate measures was the second. Third was not considering the quality of a patient's life. And four was implementing managed care policies that threaten quality of care. And five was working with impaired colleagues or unethical colleagues. And more than 30% of those nurses reported ethical issues. So, thinking of a story that has reported or involved healthcare ethics issues. There is a story to share about a school for children with autistic spectrum disorder, and about the use of electric shocks to control unacceptable behavior. And some parents testified in support of the school, saying that their children's behavior has improved dramatically. So the basic ethical issue in here relates to non-maleficence and beneficence. Does the good that is accomplished, and that's the child's behavior improving, and way outweighs the harm and the risk of harm from the use of electric shock after they endure those electric shock, and is that an acceptable behavior to resolve that unacceptable behavior from that child. So the consequences or results of the program and its treatment of the children are positive. Therefore, the goal of controlling unacceptable behavior is reached. But what do you think of that? Is that acceptable? So stuff like that is what puts us in moral distress, and moral distress has been researched, and there is an evidence that their healthcare disciplines struggle and suffer and have had that experience with moral distress, and it impacts them in two ways and in two parts. When the situation first occurs, moral distress results in frustration, anger, guilt, anxiety, withdrawal, self-blame, and so on. And then the next part is the reactive distress or moral residue. And that's where you have those lingering feelings that will accumulate over time, and you'll have subsequent moral distress. So other than that reactive distress and moral residue, on a bright side, there is that moral resilience that will emerge, and that's the ability to cope with ethical dilemmas and moral distress and restore integrity, the ability to recognize an ethical problem and be able to apply the ethical thinking and problem solving. And these are two strategies to avoid moral distress. So what are some examples of moral distress? Think of that and I'll share with you some. So you will find yourself in moral distress if you're unable to act on what you believe in being morally appropriate action, um, or when you have to act in a manner that's contrary to your personal and professional value. So let's take the example of you after working the night shift. You look and notice that one of the oncoming nurses is acting weird. She looks impaired in some way. And when you pass by, you think you smelled a sour odor of alcohol. And so you think, okay, should I bring this problem to someone's attention? But I'm so exhausted and I just worked the night shift. And okay, and also she's my friend. I don't want to be putting her in trouble, and I don't want her to be angry if I reported her. So I think, okay, maybe somebody else will notice what I notice, and somebody else will report that. So I'll go home and go to bed. And so what is going to happen is I'm gonna keep thinking about this problem. It's going to cause me to have more distress. And if any untoward effects happen at work because my colleague was impaired, I'm going to have even more built up of moral distress. And these are some of the interrelated concepts. We're going to talk about some of them. We already spoke about others as interrelated concepts to ethics and your ethical responsibilities. So these are some of the exemplars that are the features, ethics in them. And you're focusing on the confidentiality aspect in this course. Thank you for your attention.